Hi, my name is Dr. Rudra and through the Oral Health channel, today we're going to be talking about something known as melanin incontinence. Let's start. So today's episode is going to be very interesting because I've been getting a lot of calls after that episode that I released, which is known as post-inflammatory hyperpigmentation. Now, if I have to be very honest, I completely understand that you get a lot of concerns because I mentioned in that episode that you need to have some sort of chronic irritation or inflammation for that, blackish pigmentation to happen, right from a white or reddish white lesion, which heals to become black, right? Now, once that happens, it's understandable if you've had a sharp tooth which is causing trauma, you're having frictional keratosis, you have oral abusive habits, or you have any sort of dehydration or any sort of things. But for patients who have none of these things, that brings a lot of concern, because I really thought, and I was getting a lot of messages after that episode that, sir, I don't do anything, I don't drink, I don't smoke, I don't chew tobacco, I don't have any sharp teeth, I don't get cheek bites, I don't put anything there, there's no irritation, nothing of that sort. Why am I getting this pigmentation? Now, the first offshoot that I would give is, if you are a dark skinned individual, this is expected as physiological pigmentation. If you are not, then it means it is just melanin incontinence. Now, incontinence in the medical terms means like when you don't have the control to urinate, and you urinate without any sort of signal from the body, and that is known as incontinence. So melanin incontinence is a histopathological phenomenon where the melanin pigment just leaches out into the layers of the oral mucosa, and then it gives you papules or flat surfaced macules and those kind of things in the oral mucosa, which causes a lot of concern to a lot of patients about aesthetics, about cancerophobia, because they think, oh my god, because every time you write something that melanin pigmented thing on any sort of search engine, they will say melanoma, and people get scared. Now let me tell you something, the chances of people having melanoma are very less. Yeah, we do have cases of melanoma, but it's very less. If you don't have any oral abusive habits, if you don't have any teeth which are causing any sort of chronic irritation or cheek bite, there's nothing, absolutely nothing in your profile as a patient that could cause something like that. You don't need to worry about it. Just that you have to be careful if there's burning sensation in it, if there is a boil or an ulcer in it, then you have to go visit the dentist. If there is nothing of that sort, then also if your anxiety doesn't allow you to just sit back and relax, you can go for a follow-up for every 3 months to your dentist to just show them this is what it is. The dentist will see it and will say it's completely normal, there's nothing much to worry about, and then you can go back home. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message with your name, your location, and the common oral health problem that's causing you discomfort, and I'll get back to you within a couple of days. Don't worry about anything, just make sure that you are taking your supplements and your vitamins properly, you're not doing any oral abusive habits, you're eating properly, the right quantity and the quality, and you're living a happy life. So that's it for today. Thank you.